introducing our chairman, Dr. Michael Peer, the chairman of Healthcare Australia. Dr. Peer, please.
Since the inception of this organization, some 5 years ago, we have undergone numerous transformations and embarked on commendable projects back home. Our goal has been to strengthen our ties with our colleagues in Sierra Leone, the Ministry of Health, and the entire people of Sierra Leone. We have successfully executed projects and medical missions, providing free medical care and essential medications to the institutions such as at the Connaught Hospital, the local government hospital, Makeni, Royankala, Ujam, Bo Government Hospital, and lastly, our last visit to the Moyamba district where we saw about 2,800 patients. We were honored by the Parliament of Sierra Leone that received us to give us thanks for what we have done for the country. We are also proud to share that we have been instrumental in training nursing and other medical staffs, healthcare professionals to deliver exceptional care to the newborn babies in the country, which we call the Baby Breathing Project, which is being chaired by our only man, the doctor himself, Dr. Suleiman Sano, our neonatologist. Dr. Sano, we thank you for all what you do for us. He is assisted in this project by Pastor Israel, who is not here today with us due to some unavoidable. We want to also appeal to you as we have engaged in helping the people in Sierra Leone, and as we have collaborated with the Ministry of Health. You have told us in the past that we have a lot of talents and we need to come back and use these talents in Sierra Leone. We have healthcare professionals. Now we want to present them to you. Subsequently, who wants to go back to work in Sierra Leone? We want your support. We want you to make sure that they can be part of the teaching program in Sierra Leone. We have doctors, nurse practitioners who are requesting this for me to bring it to your attention, and we hope you will support us in achieving these goals. We also would like to announce to you today that our group have decided to have a service of excellence in Sierra Leone. That is, build some sort of building, hospital, to serve as a replica as the one we have in the United States, that have the basic necessity, basic things that you need when you go to the hospital. So we appeal to your government through the ambassador and you, the minister, so that you can be able to convince His Excellency to at least provide us the land for us to do this beautiful job for our people. Ladies and gentlemen, I always challenge people by reminding them what one of our presidents told us in this room. Don't you keep asking what your country can do for you, or what can you do for your country. I want to look around, try to help those unfortunate people in our country. Let us stop the whining. Let us try to solve problems. We want to inform you, Mr. Mr. Minister, that we are going to be engaged and collaborating with you, fighting the substance abuse in the country, especially push, that has plagued all our young children. We know how these guys are done, but with our help, and with your support, I am sure we will bring this to an end. we'll have a beautiful ceremony. So ladies and gentlemen, I want to invite you. Will you come and join us so that we can do this for ceremony? Thank you.
And funding, medications, and all the medical supply that we have. We have such a person here today, Dr. George Sampson. He is the president of the World Medical Relief. Give Dr. Sampson a big round of applause, guys. Dr. Sampson.
We have partnership with different universities. We are preparing a shipment, by the way, for 40-foot containers load of medical supplies and medical equipment. When he came with Miss Bridget, Hammett, and Violet, they came to World Medical League and talked to me. They talked to me about the needs for Sierra Leone. And also upon hearing Dr. Sulaiman's about the need of incubation, censorship, NGT, everybody doing this work, we have tons and tons of those. So we will support the mission. The commitment of World Medical Relief for the purpose of your mission, our collaboration, we're looking at least $2 million for your containers to be sent out soon. Right?
That's
We
nice.
will take care of that. And I can offer you a very nice list machines that came. So it's been prepared. We know that we will be receiving those on EKG machines and cardiac monitors as well. And keep on the good work. Keep on the good work, Dr. Perry, and all your members and officers. Because I believe in the Psalm 41, there are those who care for the sick poor because they will be blessed in the land. And you will be blessed in the land. You will be blessed in the land. Our founder, Leone, died at the age of 103, serving humanity. She even donated her body to Wayne State School of Medicine for study. And she was one of the stunning women in the state of Michigan. She believed in giving up to the end. It is truly amazing when you help others. Joy and fulfillment overcome our life. It is a well-meaning mission work. Help us help them for the people of Sierra Leone. My favorite verse, like he said here, success in life has nothing to do with what we have or accomplish in life, but it is what we have done for others. I will be very happy to share also the three virtues of our mission, which I believe represent our own values: faith, hope, and love. But the greatest of these is love. But love is meaningless without charity. And charity is meaningful with love. We have to show the people of Sierra Leone, we have to show the Project Healthcare Sierra Leone that we care about this project because we care about your country in Sierra Leone. It is easy to say I love you, but if you don't give, it's meaningless. Love means giving. Helping is love. Medical mission is love because charity exists. I applaud the officers and members of this memorable annual giving and fundraiser for the sick poor in Sierra Leone event tonight, for you are going to bring hope to the people there. You are indeed and entitled to be called angels of mercy. Just keep our virtues, faith, hope, and charity. May God bless you.
Put your hand together for His Excellency, the Sierra Leone Ambassador to the United States, Ambassador Sidiki Abubakar.
Wow.
Thank you so much.
So, the best chairman we've ever had, my good friend and brother, Chairman Ba, that I would choose to be today than here. So, Mr. Chairman, and all of you, esteemed members of Healthcare Sierra Leone, USC, distinguished guests, fellow citizens, and attendees, good evening. I didn't hear you respond. Good evening. I bring you greetings and the best wishes from His Excellency, President Dr. Julius Maada Monibio, and the staff of the Embassy of Sierra Leone to the United States. Before I do anything, all those people serving, I want you to stop. Some of you have created and treated Sierra Leoneans at home and also here. However, this efforts, our country still faces significant healthcare challenges. The statistics, ladies and gentlemen, is alarming. Sierra Leone has a maternal mortality rate of 443 deaths per 100,000 live births, down to 717. Let me repeat that. Sierra Leone has maternity rate of 443 deaths per 100,000 live births, down from 717. But still unacceptably high. Our infant mortality rate remains among the highest in the world. We lose talented healthcare professionals to brain drain, and our infrastructure struggles to meet basic needs. Just turn around in this room. All the people that got the awards today. If I had my wish, I wish I could get a plane given to me and grab all of them and take them to Sierra Leone and say to the doctor, here your children, they are here to serve your country. The COVID-19 pandemic has further exposed the weaknesses in our healthcare system, with 7,779 reported cases and 126 deaths as of today. The exposure to the synthetic cocktail drug, Kush, continues to rob our nation of our youthful population through untimely death. There was one instance in Sierra Leone on one day. They buried 300 young people on that same day as a result of Kush. With these painful public safety challenges, it is time, ladies and gentlemen, for bold action. And today, I want you to join me in envisioning a state-of-the-art medical practice plan in Sierra Leone as a hub for quality care, medical education, and economic growth. This is not new among African diaspora communities in the USA. Let me give you an example. 350 Ethiopian doctors raised $100 million to establish a state-of-the-art medical treatment and research cancer treatment center in their country. Do you want to tell me that they are smarter than you? No. These 300 Ethiopian doctors, they practice like any of you. There are doctors in this room that make over $350,000 a year. There are nurses here who are even making that more. Where are they from? Can you help me? Where are they from? I didn't hear you. My village boy woman. So, how did the Ethiopians do it? What the Ethiopians did, they went to their doctors and their nurses and said to them, 350 of them, he said, put in $35,000. They wrote the check for $35,000. They raised $30,000 together. And then they went to their Prime Minister then, Meles Zenawi, and said to the Prime Minister, we want you to talk to the banks to give us $75 million to round it up to $100 million. That is how they raised $100 million to build a state-of-the-art medical and research center in the country. I can guarantee you, if you did not hear, I as your ambassador will team up with you for a first-class presentation to President Dr. Julius Maada Bio. I can assure you the President will welcome you and give you all the support you need to produce a state-of-the-art healthcare center in the Republic of Sierra Leone. But it's got to start with you. Acting silos. You heard the gentleman from Korea standing here to say that they started small and now he's supplying the world. It takes a leadership. And when they say leaders, there also have to be followers. And I came here with an appeal. And that appeal is a simple appeal. The President established a commission to eliminate Kush. The ministry has tried. But I know when you, the best diaspora anywhere Sierra Leoneans are, anywhere in the world, you are the best diaspora who love and care about your country. What I'm here to ask Healthcare Sierra Leone leadership is that at an embassy, we cannot lead this. We want to take the honorable and the humble position of inviting your chairman, the distinguished chairman, Dr. Pierre, to be the chairman, Healthcare Sierra Leone, to be the leadership of this mobilization to end Kush in Sierra Leone diaspora in our country. Can I get an amen? Can I have here a public confirmation that Dr. Pierre, that you accept that responsibility, sir? Well, give yourself a big round of applause. So, I hear the minister has heard what you've said, and you all have agreed We convene parliament. We are not submitting cabinet paper. We are submitting the people's paper. And that is all of you nurses, all of you doctors, under the leadership of Healthcare Sierra Leone. I commit, as your humble ambassador, to support this initiative to do three things. I will bring international partners to this effort. Already the United States ambassador to Sierra Leone is on board. Second, USAID is on board. Third, the Interfaith Religious Council in the Americas are on board. Nurse practitioners are on board. Doctors from different medical colleges, I have recruited them. They are on board. Just like you did with COVID, Healthcare Sierra Leone led the fight under the late Dr. Michael Rogers as chairman, that we did the largest donation to Sierra Leone of any diaspora anywhere, up to the tune of $7.5 million in goods and services. We could do it again. So now that I came today, I'm leaving tomorrow, and that I have gotten what I want, I raised some money for Healthcare Sierra Leone. And number two, Healthcare Sierra Leone chairman has accepted the leadership. And when I go back to Washington tomorrow, I am going to write an official letter in my capacity as your president of Sierra Leone in the Americas, that Dr. Pierre, Healthcare Sierra Leone is the leadership in mobilizing the diaspora to fight Kush in this United States. Ladies and gentlemen, give yourself a round of applause and thank you for the opportunity.
Ladies and gentlemen, I want you to join me to welcome my brother, my friend, that I can depend on, that I can call every day. He will answer that call. Dr. Professor Charles Symosium, Deputy Minister, Republic of Sierra Leone.
Mr. DJ or Madam DJ, let me hear that song, please.
Thank you, Mr. President. On that note, His Excellency the Ambassador, Excellency Honorary Consul, my brother, Chairman of the Healthcare Sierra Leone USA, Dr. Pierre, and First Lady, and ladies and gentlemen, please permit me to stand on the existing protocols. Indeed, I'm extremely happy to be here. I'm lucky to be here this evening because, as the chairman said, I walked, I drove, I flew over many countries for me to be here this evening because I gave my word to Healthcare Sierra Leone. I believe in their mission and I believe in what they are doing. And I thank ladies and gentlemen for coming here this evening to grace this occasion. It's a pleasure for me. And on behalf again, as for protocol, on His Excellency the President of Sierra Leone, on behalf of the leadership of the Minister of Health, and on behalf of the people of Sierra Leone, I bring you greetings. Indeed, most of us in the diaspora believe we have to give back to our continent and countries of origin. And I speak directly to the Sierra Leoneans who are online and in this room, and those especially back home. We have to redefine who a diaspora is, so that we don't have any differences that will can be quietly creep between us. And I say this because I'm one of the biggest diaspora fans for the IUM designated, so we have to redefine that one. That if you are in Sierra Leone or here, especially for brothers and sisters in Sierra Leone, if you have never darkened the doors of the West, or darkened the doors of countries outside Sierra Leone, and you go back home, you are a diaspora. Healthcare Sierra Leone has really contributed a lot to our health sector. I said I run mobile clinics all over Sub-Saharan Africa, and they will be collaborating very well because at the end of the day, we look at the bigger picture. And I'm happy they are joining us at the Ministry of Health over the many years as we'll be working. And because, they are becoming so diversified, very much true to that 1946-48 definition of health, which is that state of complete physical, social, and mental and social well-being, and not only the absence of disease and infirmity. They are actually diversified in so many areas that holistic response to healthcare delivery is what is very inspiring for us. And indeed, along this line, I must also say we at the Ministry of Health and Sierra Leone, we are also equally quite ambitious. And we know there are issues, like every low and middle income country in Sub-Saharan Africa, we cannot get everything in one day, but we are on the way. And then I can also allude to the fact that some of our mortality rates used to be the worst in the world. 2014, 2015, the maternal mortality in Sierra Leone was about 1,500 per 100,000 life births. And when we took over government, in about a year or so, or two, we have reduced it to about 60%, which is stood at 770, it was 443, 2020, but I can authoritatively tell you that maternal mortality in Sierra Leone now is around 300. It will be officially published, which means every more people are doing it is going to happen. And we are not done yet. We really want to go down by 2030, at least we should do like 50 per 100,000 life births, and we have been challenged. By 2038, we should have zero mortality, maternal mortality in Sierra Leone. And child health is a problem for us. We are making big gains on maternal mortality, but the fact is public knowledge that on child health we need to do more. So we have got a lot more focus on child health. We have created a special department within the Ministry of Health, a new program focused purely on child health. We've got accelerated action now on child health. We are joining the leadership of the world, and especially the World Health Assembly, to make sure that we have pictures together with people around the world to make sure we make big gains on child health, and we are on the way. Maybe by next year when I stand here again, I'm sure we will have made big gains because we are doing a lot of things to make sure that we improve on our child health in Sierra Leone and